Hello guys, so today we are going to talk about cardiac cycle. So as we all know that human heart is a myogenic heart, which is a mesodermal in origin. A heart in which the impulse for contraction, what is myogenic heart? A heart in which impulse for contraction originate within the cardiac muscle itself. So myogenic heart is self-excited and self-regulated. It has an ability to create its own impulse to beat. So if we dissect the heart outside of our body, it still beat for some amount of time. It is not stop sudden like a neurogenic heart. So what is a cardiac cycle actually? Okay. So cardiac cycle refers to the sequence. The cycle, no? So it is a sequence of mechanical and electrical events that occur during one complete heartbeat. One complete heartbeat. It includes two things. First, a contraction, which is called as systole, and second is relaxation, which is called as diastole. ठीक है? These two processes, systole and diastole, occur in both atria and ventricles. And this cardiac cycle involves atrial systole or auricle systole or diastole, and same like it ventricular systole and ventricular diastole. So as you can see, one cardiac cycle is equal to one heartbeat. If I referring to heartbeat, it's equal to the one cardiac cycle. So normally, if heart beats 72 times per second, so if we want to calculate, so duration of one cardiac cycle happen to be 0.8 seconds. Means each heartbeat takes about 0.8 seconds. Okay, this is the activity which we are going to do later on in our this lecture. First, we are going to see the diagram of heart showing here. Okay, so as you can see here, this is the very simple diagram of or picture representation of this heart. As you can see here, human heart has three septa. What is septa? A division between atria and atria. So this is called as left atria, left ventricle, right atria, right ventricle. Okay. So interarterial septum, interventricular septum, this one, and interarterioventricular septum, this one. Okay, so three septa, four balls here, tricuspid balls. This is bicuspid ball, and then two semilunar balls, this one and this one. Okay, it has seven inlets. Four is pulmonary veins here. One, two, three, four. Okay, four is this one, and three is superior vena cava, coronary sinus, this one, and inferior vena cava. Seven inlets. Inlets mean the blood come from outside of our body, outside of our heart to the inside the heart, and two outlet. Two outlet is this one, pulmonary artery or arc, or systematic aorta or arc. Okay, this is the major structure. Okay, if we the major question asks sometimes what is the size of these chambers of heart. So the heart size is like this: left ventricle, biggest size, then right ventricle, then right atrium, then left atrium. Like you can say anti-clockwise, like here to here. Okay, so this is muscles of left ventricle, right ventricle, like this one. Column carni. Column carni is the heart muscles, inside heart muscles, which has papillary muscle, which holds the bicuspid and tricuspid walls with the chordae tendineae. Okay, so that it is stretch the this interaortical septum towards the right ventricle or left ventricle. Okay, so this is all about the normal uh, diagram of this heart. Okay, representation of this heart. This is musculi pectini is the inner musculature of atrium, more amount in the right atrium. Okay, so let's go for cardiac cycle explanation. Okay, so first initial stage is joint diastole, which is around 0.4 second. Okay, remember this time. Okay, 0.4 second. Out of 0.8 second, 0.4 second is joint diastole. What happened in this cycle? So at the beginning of cardiac cycle, all four chambers are relaxed. This is called a giant diastole, in which atria relax, ventricle relax, and blood flow passively into the ventricles from atria. Passively, not actively. Okay. Since during joint diastole, tricuspid and bicuspid wall open and semilunar wall closed. So due to more atrial pressure, because blood is filled in it, then the ventricle pressure, blood flows passively into the ventricles. Atria has a blood, more amount of blood, more amount of pressure, so automatically that blood flow passively into the ventricles, and this process is called as rapid ventricular filling phase, which is around 70% of blood filling. 70% of blood filling in ventricle is due to this. NCERT में इतना ही, okay? In NCERT, this much is given. But if we go deeper, little bit extra knowledge, rapid inflow is about 70%, and diastasis, which is 5%. Diastasis is the process in which it is also passive, in which drop by drop blood is come inside the ventricle. Okay, this is all 75% is passive, 25% is active, which is the auricle systole, which is around 0.1 second. So what happened after giant diastole? After 0.4 second, sinoatrial node, which is a SAN short form, generates an action potential, and its impulse is around 70 to 80 impulses per minute. Okay, normal it can reach to 100 impulses beats per minute also. Okay, so impulses reaches both atria simultaneously, and contraction is also happen simultaneously, and because of this contraction of atria, okay, remaining blood is also poured down into the ventricle. This is called a 25% or 30% according to NC active filling of blood into the ventricles. Okay, this much understood? Okay, so this sinoatrial node or SA node is a natural pacemaker of a heart, because it is responsible for main beating of a heartbeat के लिए mainly responsible is this one. It is where it is located. ये location आपको you have to remember. It is very important. It is located in right upper corner of an right atrium. Okay, as you can see picture here. Here around somewhere here it is situated. Okay, so right upper corner of right atrium, and all chambers are in command of this node, SA node. Okay, these electrical impulses from an SA node travels through the cardiac conduction system. Okay, this SA node goes to the AV node, and at the AV node, this conduction is delayed for 0.1 second. This atrioventricle node is very important because it delays the impulse for 0.1 second. Because of that, at the same time, both atria and ventricle will not go for contraction. Because at auricle systole is 0.1 second, 0.1 second के लिए it delays. After then, ventricle systole will start. So it delays the 0.1 second, and then after it will transmit the impulses to the AV bundle, to the bundle of His to the Purkinje fibers. Okay. So AV node is also called as pace setter. Okay. Very important. And Purkinje fiber, it is very important. Okay. Note it down that Purkinje fibers has maximum frequency of impulse conduction. Okay. NEET like question. Okay. NEET syllabus, it is many times it is asked. Okay. So the question arises, if I stop SA node, if I stop SA node, then is our heart still beat? Yes, our heart is still beat with the help of AV node, but auricle will not contract. Our ventricle will contract, but not at the beats of 70 to 80. It will around AV node beating capability, because AV node has intrinsic capability of 40 beats, 40 to 50 beats per minute. So at the 40 to 50 beats per minute, our ventricle will contract, but atria will not contract. This condition is called as heart fail. Okay, very important. Okay, now stop the AV node. But SA node will, okay, but AV node is stopped. This condition is called as heart block. In this condition, our atria or auricle will contract at the beats of SA node, but our ventricle will contract at the beats of Purkinje fiber, which is around 30 beats per minute. Okay, because it is also every node and bundle in Purkinje fiber is the muscle. What kind of muscle it is? It is neuromuscular tissue. So it has the ability for generate impulses. Okay, even AV node is stopped, your ventricle will still contract, but at the impulse or at the beat of around 30 beats per minute, not at 70-80 beats per minute. Okay, an SA node will uh, start will generate the impulses and contract the atria at around 70 to 80 beats per minute. So AV node stop, heart block; SA node stop, heart fail. Remember this. Okay. Now, next step is ventricle systole. After auricle systole, ventricle systole happen, which is happen for 0.3 second. Remember all these seconds. Okay. So now the impulse reaches the ventricles via bundle of His and Purkinje fibers. This causes a ventricle contraction, which is called as ventricle systole. Okay. Due to that, whatever blood in the ventricles flows out into the arc. Okay. Through the semilunar valves. Okay. These uh, these blood, whatever blood in the ventricles goes out from the ventricles through the semilunar valve, through the pulmonary artery, pulmonary arc, or aorta. Okay. Now, because pressure is increasing in the ventricles, tricuspid and bicuspid valve closes, because atria auricle has less pressure and ventricle has more pressure because of contraction. So tricuspid and bicuspid valve open, and it is also necessary because it prevents the backflow of blood. So due to this closure of tricuspid and bicuspid valve, first lub sound is heard, and this lub sound is what? Dull sound. Okay, and now, due to further increase in ventricle pressure, both semilunar valves open, as you can say, and ventricle ejection phase happen. Means blood come out from the ventricle in the aorta and pulmonary artery. Okay. So after blood is pumped out, okay, blood is pumped out from the ventricles. Now ventricle relax, so ventricle pressure is again decreases and arc pressure increases. Okay, pulmonary arc uh, and aorta arc. Okay, so at that time both semilunar valves closes. Again, it closes to prevent the backflow of blood. So this closeness of semilunar valve produces the second heart sound, which is called as dub, which is a sharp sound. This sound is heard sharp. Okay, if you heard it from the stethoscope, it sound is sharp. Okay, now except if these two extra sound, if you heard from stethoscope, then there is that condition is called as heart murmur. Okay, it is an indication of there is some defective valve is there is some defect in valve of the heart. Okay, now after the closing of semilunar valve, okay, ventricle pressure lower than the atrial pressure, auricle pressure. Okay, this creates tricuspid and bicuspid valves opens, and again blood begins to fill ventricles. Soon SAM fires and next cardiac cycle begins. Okay, this is all about the cardiac cycle. Okay, so during the ventricle systole, always remember that our atria is relaxed. Okay, and only during this phase, when tricuspid and bicuspid wall is closes, atria relax, blood is filling in this atria. Okay, and this blood which is filled in atria in joint diastole come out into the ventricles. Okay, the students are asking that at what time, sir, atria filled with the blood. So during the ventricle systole, atria filled with the blood. Okay, and it is empty at the joint diastole and auricle systole. Joint diastole passively and auricle systole actively it empty out its blood, filled blood. Okay, now there is an activity for you guys. Okay, so this is the diagram. So the outer circle is auricle representation and inner circle is ventricle representation. So as you can see, this is around 0.8 second. This whole circle is 0.8 second. So this circle is divided into 8 quarters. So this 0.1 second having a auricle systole. Okay, and then this 0.3 second is ventricle systole. Okay, and this all are 0.4 second, which is a joint diastole. Okay, okay, so color representation is contraction and uncolored representation is relaxation phase. Okay, so if I ask how much second, so first of all, step 1 is auricle systole. Write it down here. Auricle systole. Step 2, 3, 4 is ventricle systole, and step 5, 6, 7, 8 is joint diastole. Okay. So question, total duration of systole in heartbeat. Total duration. The total duration is 0.1 here, 0.3 here. Total is 0.4. And joint diastole is also 0.4. Okay. So that is about the small activity I gave here. Okay. If I ask, see this picture. If I ask, what is the duration of ventricle systole? Total ventricle systole duration. Okay. So it is how much? Here it is 0.4 and here also. See here. Total ventricle systole is around 0.5 second. And auricle from here to here 0.7 second. I'm talking about diastole, okay? Don't confuse it with systole. So this 0.7 second is for auricle and this 0.5 second for diastole, for ventricle diastole, VD, AD. Okay, the question can be asked like that also. Okay, this is the uh, very good representation of, or I can say good way of representation of auricle and ventricle systole. Okay, so that's all for today classes. In the next class, I will talk about the cardiac output and all the equations related to the, or I can say formulas related to the heart, like what is the efficiency of heart and all, and some one or two or three numericals based on that. Sometimes it is asked in NEET syllabus, NEET exams. Okay, so thank you and take care of your heart. Okay, thank you.